that individual is trying to feed a family of 4 and purchase health insurance, they may have to come out of pocket 20% of their annual income just to be able to get into the health care system to have health insurance. So am I going to fork over 20%, 25% of my annual income after employer subsidy to get into this program to only be met with a $3,500 deductible? That's this huge barrier to entry into the healthcare system. I'm just not going to go receive care.
Thanks for tuning in to the Self-Funded with Spencer podcast. Let's go make healthcare better together. Trey Smith, no relation, although maybe a very, very distant relation. But thanks for coming up from San Antonio, Texas, man. Good to have you.
Yeah, it's great to be here. Thank you for having me.
And I was going to say, not in your 2,500 Dodge Ram. They gave you that as a rental car. But
beautiful rental
I figure
truck.
You just drove up here in your big old Dodge.
I might have to just purchase some sort of, I don't know, trailer and tow something with it while I've got it.
That'd be fun. You take the rental back with a trailer on it. Like, what are you doing?
Yeah, I'm sure my wife would love that. What toy did you buy now?
Yeah.
So,
all right, man. Well, I appreciate you coming. I think this is going to be a really interesting conversation. If you don't mind, introduce yourself and what your role is at Hub, and we'll get some of your background as well.
Yeah. So, Trey Smith, I work for Hub International here in Texas. I'm our employee benefits sales leader. So I lead our employee benefits consulting team across Texas. Then I also have another role at Hub too, where I serve as our area president of our San Antonio operation.
Okay, so you basically have 2 jobs then.
It wouldn't be Hub if you weren't wearing multiple hats.
Well, I guess I can somewhat relate with my Pareto job and this job,
That's
which,
right.
Thanks to Nathaniel, it looks like a full-time job out from the outside looking in, but the reality is he takes a lot of the efforts off my plate. But I kind of enjoy having a lot of responsibility, and I guess you do as well.
Yeah, absolutely. Yeah. It keeps things interesting. The day is never the same from day to day.
Are we masochists? We just love a lot of pressure and stress. I think that's maybe what it is.
Absolutely.
So how'd you get into the business though, man? I think you telling me over coffee you had a family connection to benefits, right?
So my old man has been in the insurance business since he got out of the Army in the 70s. And so that's how I was familiar with the insurance business. Never had any plans to go work with him or go do what he did. I just wanted to get a piece of paper, get out of school, and go settle some debt that I had.
Was it gambling debt or? Yeah.
No, I had student loan debt because I did so well in school. My parents were like, I think you get to pay for it now since you're doing so well. So had to pay some student loan debt back and just wanted to go get a job and figure out how to get rid of some of that debt. And the insurance business, I thought I would sell something out of school. I didn't know what it would be.
Okay.
I was an agriculture major, which
at A&M, right?
I'm a Texas A&M University graduate and an agriculture major, and I thought that I would sell seed or fertilizer or get into banking or financial services in some way, shape, or form, and wound up kind of tripping into the insurance business.
Well, most of us did. So what was your particular trip into insurance then?
Well, I was going to work for a general agency here in Dallas. They undid a program that I was signed up to do. I'd got my insurance license my last semester, my senior year at A&M. Okay. Had a job all lined out, and that program went away when I was on the way to my wedding. So, and my wife wasn't working. She was student teaching at the time. We got married right out of college. And so I had no job. She had no income because she was student teaching at the time. And so we got back from the honeymoon, and then I started smiling and dialing people that were in the insurance business in the Dallas-Fort Worth area.
Well, so I want to understand, literally on your way to your wedding, you get called that this program, so you were banking on this job or this program to be happening after you got married, and you find out on the way to your wedding that it's no more. That's crazy.
I think my net worth at the time was like negative 20 grand, and I had no job. And so,
and the wedding.
And I was on the way to the wedding. And so we got back from the honeymoon and started smiling and dialing. Luckily, I had, because my dad was in the insurance business, I knew some people to call, but I just started calling insurance carriers and saying, hey, do you have a rookie program? I'd love to join. And so I talked to probably 12 different companies at that point in time, all in a mad dash scramble to get a paycheck, really.
Yeah, I understand.
And
how long did it take you to find that first one that said yes?
Probably about a month after the wedding I started work, so it wasn't too bad, but it was old school, like Rolodex, writing names and numbers on napkins. I had no idea who these people were or what they did. I just knew that they ran some sort of insurance company, and I was just calling going, hey, I'd love a job.
Yeah. I guess it worked. To your point about that time frame, one of my sales managers at Sun Life told me back in the day when he was starting out as a rep and calling on brokers, there wasn't benefit flow. There wasn't Judy Diamond. It was like, hey, here's a yellow pages. Go call on all the ones that look like they're brokers, and that's your territory. And
Yeah,
he's like,
that's exactly right.
Okay, cool. And you just start smiling and dialing, right?
So Pacific Mutual, now Pacific Life, hired me. I think I was the 12th rep hired out of 12 at that point in time.
Okay.
All of my brokers that I was supposed to be calling on, trying to get them to sell Pacific Life small group product, were in a DOS-based system. So it was like blue and black and yellow font. I had no idea who these people were. Most of them were like farmers agents, State Farm agents who didn't even sell health insurance because I was the 12th hired out of 12.
You got the scraps,
and so
right?
I got the scraps.
Yeah.
But I figured it out along the way. Even though it took me probably 2 months to figure out what a deductible was, which is a core part of what I was actually selling at the time.
Of that health insurance product.
Yes.
Yeah. So you were saying over coffee, like you one time somebody had you asked to explain it, and you're like, I'm going to get back to you on
That's
that.
exactly right. So how does your 80/60 coinsurance 500 plan work? What is the deductible on that? You know what? That's a great question. I'm going to go track that down. I'll get back to you.
But, we're joking tongue in cheek, but I actually think there's a lot of respect that you can earn when you are going and selling something and you don't have an answer rather than BSing your way through it. Most of the time people can sniff that out, or even the person that's asking you the question probably already knows the answer.
Totally.
And they're testing to see if you know it. And so if you don't know, I would say any young salesperson that's listening, say, I don't know, and I'll get back to you, and they'll respect you for that.
Yeah, fortunately, along the way, I got a lot of mud on my face, but I have more of the answers now than I did then.
Okay, so you started in the world of selling small group, huh?
Yep, started selling small group health insurance. Did that for a couple of years. Went to work. I had buddies that were selling life and disability business, working for some of the larger carriers on that side, the Hartfords, the Unums, the Mets, the Standards of the world. And they were doing a lot better financially than I was, and I was arrogant enough to think that I was better than they were. So I said, I'm going to go give this a whirl. And I got into that side of the business. And then that led me to Aetna. I went over to Aetna here in Dallas as an ancillary rep selling life and disability, packaging it with our medical team.
Okay.
Did that for a little while, and then I was fortunately asked to go sell health insurance in the mid-market, large group national account space at Aetna, and then it kind of took off from there.
Well, there's you and I are discussing this, and I think it's relevant because unfortunately, sometimes an ancillary rep sort of is looked on the hierarchy as relatively as a sales rep or in the insurance business, like, oh, they're an ancillary rep, which I think is unfair to be clear. But there's also this as a draw because you can make a lot of money on the ancillary side also.
Yes.
You can make a lot of money.
Yes.
But there's also this like allure of the medical where all the complexity and all the meat is, and there's an excitement about discussing it that can draw you to it, even if you might actually not make quite as much money over there. And did you feel some of that or pressure from other people saying, you got to get into medical, you got to get into...
I mean, yes and no. Okay. Fortunately, I had a mentor in the business at that point in time that was like, you really kind of need to go to this side of the business, and I think you're really going to like it.
What do you know why he was encouraging you to do that?
I don't know. Maybe he thought that like I dug a little bit deeper into some of these things and wanted a little bit more. Not that life and disability and the ancillary side of the business isn't intellectually stimulating. I think it was. Yeah. There's plenty of that there, but I think I had built some relationships at that point in time, and they wanted to give me a crack at kind of going up market on the medical side, and so it gave me a great opportunity. Obviously, learn the self-funded market, what that looked like, working inside the walls of a big carrier. And then I got to work with people that were much smarter than me on the consultant side. And so there were a number of consultants there, along with my mentor at Aetna, that gave me the opportunity to kind of get mud on my face and kind of teach me some of the self-funded game.
Yeah, and I never was in the ancillary world, but when I worked as an analyst at a broker, I would see the renewal packages put together, all the effort that was put on procuring the medical solution, especially if it was self-funded. And then you go sit down in the renewal conversation with the client, 90% of your time is spent on that piece. And then it's like, oh yeah, we're just going to renew with Lincoln or Mutual, right? And it almost became this afterthought, which I thought was unfair, but most of the dollars are being spent on healthcare. So it makes sense that most of the emphasis and time is spent there as well.
Yeah, it was kind of like, do you want to spend your time having conversations that 90% of the time is focused on? Or, do you want to be an expert on this other 10%? And it's not to shun the ancillary business or those reps, but I kind of wanted a seat at the table on the bigger piece of the pie.
Well, that's what the draw for me was like, oh, if this is the point of emphasis for consultants and the employers, I want to be in that space. I want to be in the space that's the first item in that renewal workbook that we spend most of the time on. I want to be a master of that, and that was part of the draw for me. But how long did you spend at Aetna then?
So I spent 5 years.
Okay.
I spent 5 years at Aetna. Was traveling a fair amount. Had young kids at the time. Was looking to do something a little bit different. I loved my time there. And went back to the ancillary side of the business.
Did you? Okay.
For a short period of time before I made my way to Blue Cross, and then spent the last 9 or 10 years of my career at Blue Cross in a number of different roles.
Yeah, and was that mostly upmarket at that point, like larger group stuff, or what?
Yeah, larger group stuff, and then I got into kind of management and executive leadership, in my time at Blue before I came to the consultant side of the business about 5 years ago.
Yeah. So we'll obviously focus a lot on your consultant work, of course, for this conversation. But having spent time at some big carriers, I'm sure you got an opportunity to see inside of the four walls of the business that sometimes I would say unfairly perhaps gets demonized or fingers are pointed at these big businesses, but they're great businesses, and they have great people working there. But what are some of the things that you think you learned operating within an Aetna or a Blue Cross that is helping you now on the consultant side of the house?
That's a good question. I think one of the biggest challenges that you have in some of these larger organizations is finding where your lifelines are and who can get stuff done in that larger kind of sometimes referred to as like a bureaucratic organization. Yeah. And so you have to be resourceful. The best ones that work for the largest health insurance carriers or some of the largest insurance companies are resourceful individuals that figure out kind of where the bodies are buried, so to speak, and who can get something done.
There's the politics of it too. There's bureaucracy politics, but you work at a massive corporation. You have to be a master at navigating the internal politics of a business as well to get stuff done.
And you can't bulldoze anybody in it either. So you've got to figure out who's going to be there to support you, who can deliver value that maybe the outside market doesn't see. Yep. Who are the good people that are doing good work inside the walls of that organization that want to do good work for the members and consultants, that are the ones, touching and feeling the product a little bit more.
But you mentioned having a seat at the table, and I feel you there, right? Part of the reason I think I do the podcast is it's almost now I've got a table and people will come to this table.
Chronic health issues, surprise out-of-network medical bills, inflated medical and prescription drug prices. These issues cost self-insured employers hundreds of millions of dollars every year. Add to this the rising cost of care and potential for waste across the life of a claim, and it's clear that self-insured employers need innovative solutions that lower their health plan spend. At Valence, we've done just that, developed innovation that shifts the current paradigm, a complete and integrated ecosystem solution driven by data, one that manages and simplifies the complexity of medical claim costs. It is through analyzing millions of data points that we enable employers to realize and fuel cost-saving solutions. Valence experts come prepared from day one, targeting the fraction of claims that will drive the majority of health plan costs. That is how our team lives the Valence promise, engaging early and often for smarter, better, faster healthcare.
But I always thought it'd be cool to be in the boardrooms where big decisions are made, or you got a chance, I think, to meet with some really massive organizations to bring them into Blue Cross or an Aetna. So were there some business lessons that were learned in talking to somebody that's managing a 25,000 life plan or whatever?
Yeah, it's a really good question. So in my time at Blue, I wound up obviously leading a large number of individuals that were on the team, but then also the external facing side of that and understanding the problems that exist in much larger businesses and what they're trying to solve for. There's a reason why we have market segments or business segments, in the insurance industry. You've got a handful of challenges that exist in each one of those, and sometimes they don't necessarily translate to larger business. So small, mid-market business, there's a reason why they're segmented that way. But once you start working with larger employers, obviously there's egos that are involved. There's also different expertise. Oftentimes, those folks are trying to grow in their career as well. So what's important to them may be a little bit different. And so there's nuance to each individual relationship with some of those larger organizations that
Yeah, but that's like the real world MBA, the proverbial, real world MBA is like getting a chance to see how those decision-making processes play out. And sometimes you win them, sometimes you don't. And there's probably better lessons in the reasons why you didn't win them, getting some of the reality of how that whole procurement process takes place. But when you got over to consulting, was there a draw to it? Did you stumble into it? Like what brought you on this side of the table now?
Yeah, so part of it is like my own ego and my own arrogance. I've worked with brokers and consultants all over the state, and I thought, well, maybe there's a way I could do this differently or I could do it better. And so I've always eyeballed, my whole career, the broker consultant side of the business. And it didn't happen in like the same track that I wouldn't have drawn up my career, the way it's worked out, but I wouldn't trade it for the world. And now I feel like I've got a unique seat at the table to help our consultants, to help our account management teams to solve problems for, larger organizations as well, and kind of, use some of that experience that I've got, to help them grow their businesses and to really settle in on their relationships with their clients and do great work in that space.
Yeah, so I totally get that. And coming over to this side, get that you have the confidence that you can do it. You got to have the confidence that you can do it for one. But was there elements about the responsibility of a consultant that appealed to you that you weren't getting on perhaps the carrier side?
Yeah, I think one thing when you're on the carrier side, you're a little bit removed from the executive relationships that exist with that client. And so getting closer to that was always appealing to me. And actually like not trying to sell the broker or the consultant on what I think the right solution is for the one product that I'm selling for the one company that I represent. It's multifaceted. And the thing that's kind of blown me away about the consulting business now is you can understand health insurance and you can understand how life and disability works and you can understand how complicated the healthcare system is in this country. But there is so much more that we do on a daily basis for our clients that have nothing to do with any of those things, from HR technology and integration and compliance. And sometimes it's the health insurance plan, that's third or fourth on that list from other things that the HR team or the CFO is trying to solve for.
Yeah, absolutely, man. And I like the idea of in the consulting world, and having never been a consultant directly myself, I think sometimes people assume I have. I've never been one. But the responsibility is you have this vast ocean of potential solutions, and your job is to help that employer identify their problems first, like the specific name the problems we're trying to solve, what their business goals are, where healthcare might fit within those broader business goals, and then you go out to the market to source those solutions. And so there's a lot of responsibility, and that's, to me, that's the differentiation between consultant and broker. Broker can shop the market and get insurance products. A consultant is tailoring a solution set to that particular business needs. And there's something very attractive about that, but that's also a heavy responsibility that I think a great consultant has as well. Because let's say you bring something to the table and it doesn't exactly work, that's partially your responsibility, right?
Absolutely. Absolutely. And I think if you look at, especially in the consulting space now, the number of point solutions that exist, the number of vendors, that are playing in the periphery of the healthcare space now, there's a lot of money, a lot of private equity money that's been thrown at our business. And so trying to stay up to speed on all of these new products, these new point solutions, these new vendors that are coming into the market, and then quickly trying to determine, is this solving a problem or is this just something we're going to layer on, more complexity for the client, and how do you leverage those and utilize them?
Yeah, see, I have the same issue you have with being inundated with those people, but from a different lens, right? I get to fly in a helicopter above the fray and go, oh, that looks cool. Let's land there and let's talk to them. You have a different set of responsibilities in that all these are coming in. It's really noisy, but you've got to go, oh, well, that one actually looks interesting. Let's investigate that. And then if you do bring it to the table, again, you're helping an employer decide that they want to use that tool. And if it doesn't work, it doesn't work, right? And so I sometimes don't envy the position you're in, because if you want to be innovative, yet you might be the guinea pig for a new solution, or your client might be the guinea pig, and there's risk, there's business risk in bringing that to the table. So that edge, the line that you have to toe of innovation, but also the possibility, because there isn't a track record of success for that thing, that might actually come back to bite you at some point too.
I would argue that there's risk on both sides of it. So there's risk in being innovative, and there's also a lot of risk in not doing anything and settling for the status quo.
You're spot on about that, man. That's believe me, I agree with you there. So let's get back to present day now. How did you end up landing at Hub?
So spent 20 years on the carrier side of the business, spent the last 5 or 6 years on the consultant side of the business. Hub was growing in Texas. They were looking for somebody to lead their employee benefits practice. Fortunately, some of the firms that Hub had acquired in Texas were also really good friends of mine. So there was a track record and a relationship there. And that ultimately kind of led me to Hub and the opportunity to kind of lead the benefits practice across Texas.
Yeah, so somebody that doesn't know, a benefits practice leader, give me a kind of brief bio of what your daily responsibilities look like.
Yeah, it's different depending on the firm that you work in. Like inside the walls of Hub, it's a pretty dynamic job. So I'm there to assist from a strategic perspective with all of our producers and all of our consultants and our account management teams to make sure that we're deploying the tools and resources that we've invested in and deploying those in a meaningful way to the client.
Okay.
So there's a lot of kind of strategy work that's done there. But then also being a former Blue Cross guy on the consultant side of the business, one of the hats I wear is if there's an issue with Blue Cross that comes up,
they call you,
they're
right?
calling me.
Yeah.
They're calling me to try to help.
Can you go
That's
get
exactly
some influence?
right.
That's funny, man. You're the insider then that hopefully can get some connections to get things done.
Yeah.
But building a business is a big part of this, right? So like as a sales leader, you've got to go out and make decisions, whether that's helping on acquisitions, that's hiring, I'm sure, to bring in other sales leaders, because you're building a business. And I think you gave me an idea of how quickly that's been built over the last couple of years. It went from like 2 to 100 million or something.
So
like
Hub 7 years ago in Texas was about $2 million in employee benefit revenue.
Okay.
Today, 7 years later, we're about 110 million of employee benefit revenue across
That's
Texas.
crazy growth, right? And I know some of it's through acquisition, of course.
Some of it's organic and a lot of it's acquisition as well. And the way in which we operate is a little bit different in the fact that, these are regional independent firms that are coming to Hub. And part of my job in leading our benefits practice is not screwing up a very successful business that's been built. One of our most recent acquisitions is a 150-year-old agency.
Whoa.
The larger acquisition before that was a 100-year-old agency.
Wow.
So
these are multi-generational businesses,
absolutely.
right? Yeah.
And they built a brand, a successful brand in the markets that they serve, in the communities that they serve. They've done great work. And so my job is to come alongside them and not screw up the success that they've had.
Yeah.
But then open up, some opportunity for them to understand the tools and resources that we have at Hub, how to deploy those, and maybe go after business that they didn't feel comfortable with when they were a regional firm or felt like they didn't have the resources. And so I come alongside them to help on larger deals that they might be going after.
Well, and you hear in the marketplace, right, there's talk about whether consolidation is a good thing or not, right? And there's some really large acquisitions that have happened recently. But give me a little bit of the mindset of somebody who's built a 150-year-old agency, probably stayed in the family for multiple generations in a row. Why now? Why would an organization like that probably could still continue to stand on its own, why do you think they say, hey, you know what, we're ready to actually fold up into a Hub, as an example? What do you think that the motivation?
I think there's a number of different reasons. Probably the main reason is it's not that they don't have the tools and the resources or the know-how to go sell business. I think oftentimes the business has gotten more complicated.
Yeah.
And so they've borrowed some of those resources. They've bought some of those tools to kind of cater to the need of hanging on to the business that they have. But it's how do we grow this business? For the ones that want to grow and kind of want to take it to the next level, there's a whole different kind of operational model that's required. There's additional tools and resources that they need to purchase or need to partner on to go up market. And then oftentimes too, there's money at play here too.
Obviously.
I mean, I'd be a fool not to say that. Like the private equity influence and the investment that has hit the insurance business from a brokerage standpoint, it's a good investment. Mm-hmm. Like if you go look at the publicly traded brokerage firms out there, they've all done really well. Yeah. And they've grown through acquisition. But it's from an investor's perspective, it's usually a good buy.
Yeah, and it makes sense, right? And I'm not really making a judgment whether it's good or bad for the industry. I mean, there's an argument for either one of those situations, and I think this is why the beauty of this is where the employer can ultimately decide who's the best fit for them. But I'm seeing it harder and harder, and the reason I raise this question is harder and harder for the independents to keep up with the market because of the access to resources, because of some of the financials. You might have a mom and pop that's built a great business. Eventually, they probably either want to sunset, maybe the children don't want to take over the practice. Eventually, they're probably likely going to sell for a multitude of reasons. And it's just, how do you maintain a space for those independents to still operate, knowing that there's so much consolidation going on, and it's up to the buyer and the seller ultimately to decide what the right fit is. And for what it's worth, and I'm not saying this because you're sitting here and we partner with Hub, and so I'll just get those caveats out there, but from what I've heard of people who have been acquired by Hub, universally say they were glad they did it and would do it again because of some of the autonomy that you guys continue to extend to those practices, where it's not a lot of, hey, this is our way now and we're changing your business overnight. You really do seem to give them the continued freedom that they had prior. They just have all those resources now back behind them. Yeah,
I think it'd be foolish for us to go take a very successful business that has its own unique culture and then try to change that overnight for what? So I think the other thing that's changed the business too, that has brought a lot of consolidation, if you go back to the Affordable Care Act, you go back to 2014, what has been put on, we've turned from a brokerage business into a consultant business, almost out of pure need, because the Affordable Care Act changed everything. So I talk to our account management teams a lot about this. It seems like account management has been like the dumping ground for anything new, regulatory, legislative, new paperwork that has to be signed, a new system that has to be built. All of that has taken place really since the Affordable Care Act was passed. So we can't just like go represent a product and go broker that product in the market and go negotiate that rate. There's so much more to it, from technology, from compliance, from HR consulting that has to be done. And so I think that's a bigger source of the change and consolidation.
Yeah, I would think I would agree with you. And I've seen a noticeable shift in the world of consulting. So I've been selling into brokers/consultants for 12 to 13 years now. The demands that continue to be placed on your organizations on behalf of these employers continues to expand. And I don't know if there is a breaking point where the stuff that keeps getting pushed your way is just too much. And I don't know if you're feeling some of that pressure, but it's almost like, oh, now my consultant can handle that, my consultant can handle that. And effectively, you're helping them run their businesses at this point. And it seems to be that is what today's consultant is responsible in doing. Do you share some of that sentiment?
Yeah, absolutely. And so if you look at the investments, not only Hub, but most brokerage firms have had to make, it's finding experts in all of those different kind of nuanced pieces of the business to come alongside the client in the right way. I mean, if you would have told me like 15 years ago that brokerage firms would have had HR consultants on staff or HR technology consultants on staff, I would have told you
chief medical officers, like
chief medical officers, clinicians and nurses and compliance attorneys and all of these things. I would have told you were crazy, but that's absolutely a core component to be able to serve the client given all of the needs that they have.
Well, I say benefits consultants almost feel like they're turning into like McKinsey or, these third-party consultants that come in and troubleshoot businesses. But the reality is, I think the necessity is what drives that. We often cite that this is the second or third largest line item on most employers' balance sheet. There's a lot of scrutiny that comes with millions to tens of millions of dollars of an expense item, and that necessitates better consulting to help solve that piece of the puzzle. And so I don't see that necessarily, that trend discontinuing anytime soon. And I just sometimes will say that I don't necessarily envy the position you sit in. And I view our obligation of somebody like me is just to make it easy to do business with me for the right situations, because you have 99 things that you also need to think about on a daily basis. Pareto Health is the largest benefits captive in the United States. With nearly 3,000 captive members, $1.3 billion of stop-loss premium in force, and almost 1 million covered lives, no other benefits captive comes close to Pareto Health's scale. But it's not just about the numbers. Pareto Health is a mission-driven organization, and that mission has two distinct parts. Number one, to to make self-insurance simple and more accessible for small to mid-sized employers. And number 2, to arm them with the most powerful cost management tools on the market. So if you're an employer frustrated with your healthcare outcomes, or you're a benefits consultant looking for an alternative to the status quo, it's time to consider Pareto Health. Pareto Health, where employers come to do self-insurance right, to do it easily, and to do it at scale. Why don't we talk those State of the Union, Trey? So maybe we want to keep it focused to Texas or focused to healthcare in the U.S., but you're giving me some statistics over coffee that were pretty eye-opening. And I think it's always good to say, here's where we are today. Let's talk about how we fix some of those things. So why don't you give us those?
Yeah, I would say the biggest challenge that I see, obviously the cost of healthcare in this country is out of control. Everybody knows that. But I think one of the bigger struggles, if I think about the folks that we serve, the clients that we work with, I try to focus and get our teams to focus more on the employees that work for those clients that we serve.
Okay.
And their access to the healthcare system and the cost of that and what does that look like.
Yeah.
And so from a concern perspective, the average kind of dual income that we're working with, the employee that's purchasing health insurance with the subsidy from their employer is right around $68,000, $70,000 a year.
Okay.
So if you think about the cost of this stuff, it's ridiculous in the fact that that individual is trying to feed a family of 4 and purchase health insurance, which gives them access to the healthcare system.
Right.
After their employer subsidy, they may have to come out of pocket 20% of their annual income just to be able to get into the health care system
insurance.
To have health insurance.
Yeah, that's crazy. So just kind of rough math in my head, that's about $6,000 gross a month. There might be taking home $4,000 to $4,500 a month. So $2,000 to $2,200 a paycheck. Then you think about, you have a deductible of what? What would you say the average deductible was?
Right around $3,500.
Yeah. So all that's coming out of my paycheck. This is my take-home pay, and then I have a $3,000 or $4,000 deductible. That's functionally uninsured at that point, right? So if you think about premium being your first deductible, your actual deductible is truly the impediment for most people to go seek care, unless they absolutely have to. Then they have to worry about, well, how do I actually pay this bill afterwards? And that's the thing that every day I'm going, how do we solve this? This is the main problem in healthcare right now.
Yeah, that's the part that concerns me the most. From a personal values perspective, it's really difficult to get to a place where I feel like if we're not doing right on behalf of those employees that are struggling to make ends meet, and the average, we talked about this earlier, but the average annual cost for fully insured family health insurance coverage through Kaiser Family Foundation, so it's their study for 2025, is $26,000 annual.
That's crazy, man.
So am I going to fork over 20%, 25% of my annual income after employer subsidy to get into this program to only be met with a $3,500 deductible? That's this huge barrier to entry into the healthcare system. I'm just not going to go receive care.
Yeah, or I'm going to.
I don't have any money left to go do it.
I'm going to opt out altogether and just cross my fingers that I don't get sick. But so, what do you see most employers on average of the share? Because I think a lot of employees aren't actually aware of just how much of the cost burden the employer is enduring. So, what percentage do you usually see of that $26,000 the employer is picking up on behalf of that family?
Yeah, it really depends on the industry. Some industries are a little bit more competitive for talent, and so the employer subsidy to the employee costs are a little bit different based on industry. But I would say anywhere in that kind of 75% to 100% of the employee-only cost. And we're seeing fewer employers actually contribute to the dependent lines of coverage, to
really?
employee spouse coverage, employee child, employee family coverage. And so we've got two things occurring at one time. You've got higher deductibles, and then you've got more costs being shifted on the spouse, child, and family tiers of that coverage.
Yeah, and so you look at that and you go, there's got to be a tipping point at some point. And I felt like that for the last few years. It never quite comes because we sort of just stave off catastrophe or implosion of the healthcare system just by the skin of our teeth every single year. But that's an astonishing amount of money, especially when you put it in the context of how much the average median household income is. there's a point where the employer is going to have to throw up their hands potentially if they don't solve this, which I think is why ICHRAs are becoming more popular, is them just simply throwing their hands up and saying, I'm out of this business altogether. The reality is, though, I don't know if we can fix the problem in totality without having better conversations with individual employers, and to me, just fixing that one employer at a time. So now we've stated the problem, right, which is the cost prohibition from getting care. What are things we can do for an employer to actually solve that particular problem in your mind?
Well, there's a number of new solutions. So for the first time in Texas, we have new entrants into the health insurance space in the last 2 or 3 years, which is crazy. We had consolidation for really 20 years, and we were down to essentially 4 carriers, and now we've picked up a couple of new carriers in Texas the last couple of years. But removing that cost barrier is really kind of where I like to focus and where I like to steer our clients if they're willing to move in that direction and start offering programs in which there's first dollar coverage for care.
Yes.
So if they're going to come out of their pocket all of this money to have health insurance, let's actually provide them a benefit that they can use.
Yep.
And I think if you look at studies and analysis that are out there now, your UHC and their Surest product, which is a little bit unique.
That's kind of
in
a
the
copay
market.
range, right?
Yeah, it's a copay range, but there's first dollar coverage there, so you don't have that big deductible burden that sits out there. I think they've got over 1 million members now in that platform. And if you look at the utilization trends, and we're seeing this from other carriers as well, not just UHC and Surest, but when you put in these either zero out-of-pocket programs or first dollar coverage programs, eliminating that big deductible, what you see from a claims perspective is you see higher utilization initially in the first 8 to 10 months of the plan. And then in months 12 to 18, you start seeing overall claim spend come down.
I believe you.
And it makes sense, like logically it makes sense because you're engaging folks in the healthcare system that weren't previously, probably because there was a bigger deductible or big cost barrier to entry. Now you're removing that, so they're going to go utilize services. But at the same time, I think there's benefits to that as well. The more folks we have engaged in the system seeking treatment just for preventative care at the same time, we're avoiding big ticket items that we didn't know existed, but we're also leading to a better trend line overall because we're avoiding some of those big ticket items.
Well, it logically follows that you would see an increased cost early on for all the reasons you just described. But it also logically follows that you should see that crest and go down over time because you've caught the stuff that wasn't caught before. So yes, there was a cost associated with it. But you've also very likely caught stuff way earlier and or perhaps prevented the kind of materialization of a catastrophic disease state or something that's going to be costly in the future. And it's really where I think we need to go. If you look at what high deductible health plans were sold to be, consumer-driven healthcare, because now you have skin in the game. The problem is there's so much skin in the game that people weren't able to actually seek care because they couldn't afford it. And now you had delayed care and avoidance of care, and now you had a resulting higher cost because all you're getting is a really sick people getting those catastrophic types of care. This is the opposite. Consumer-driven by removing the impediments altogether with the waiving and the cost share. But I think you have to do it intelligently. That doesn't mean waive deductibles altogether and say, go, good luck and get the right care. I hope you do a good job deciding. There has to be some guardrails in place to do it effectively, right? Like tiering of the network and things like that.
Absolutely. Okay. And we're living in a kind of a new age of technology here where some of the transparency legislation that came out has opened up the door for other data companies and new entrants into the market to be able to provide us data in a unique way that we can take to clients where we can more accurately predict what the cost of service is going to be, what claim costs are going to be, so that we can design the right program around that instead of kind of guessing directionally about where we think claims might go given benefit plan design or given what the network is that we're using, the provider network that we're utilizing.
Yeah, I mean, there's two metrics, right? Cost and quality, right? And so I think that is the arms race at the moment, is to get access through that data, whether from the transparency laws and the hospital pricing, but you have these gigantic machine readable files that have like trillions of lines of data. So like you have to be able to make sense of it to actually make it simple enough to steer somebody to the right place, right? So like how do you actually triage the cost and quality to get to the person to that right place?
Yeah, so the data is getting better. It's not, I mean, from a transparency perspective, it's there. Thank God there's really smart people in the data science space that can pull all of this together for us. And then take somebody as dumb as me that can actually articulate what's actually occurring in this data.
Yeah.
But we're getting quality information and cost information all at the same time. And when you meld those two together, what you have is you can put in place tiering like you talked about, but also not just steer employees in the right direction. You can eliminate all of the noise that most of them have been forced to deal with, all the different point solutions and all my pharmacy program and all these benefits. The insurance layman can't navigate this system, and I don't blame them. Like, my wife had an issue with, she was a runner. So she had to go get an MRI done. Doc's like, go get an MRI. I'm like, call the 800 number on the back of the card. They're going to direct you to where to have the MRI done, and they'll schedule the appointment and all that for you. And she's like, well, I'm not going where they tell me to go. And this isn't a shot at my wife. She's like, the doctor's telling me to go to this facility. Well, that facility is charging $3,200 for that MRI. The same story that we've heard a number of times. But this is my wife who's been married to me for almost 25 years now. And she's having a hard time understanding how this system works. So I think about somebody who is completely new to this or doesn't understand how it works, and then we throw all of these apps at them, all of these point solutions. It's very difficult for them to figure out just where to go get care. And so what the data, getting back to the data point, what that's enabling us to do is simplify that to where we're cutting out all of the noise and we can find the best facilities, we can find the best providers and send them there without getting into all of the logistics and all of the education that must occur.
The friction that would normally occur, right? And we were talking about point solutions before, but like if you have 7 or 8 different things that an employee has no idea what they are and they don't know to call, what's usually the default response? Go where my doctor says, or I'll go to urgent care or ER instead, right? So like you have to simplify the interaction with the healthcare system for the average person who doesn't think about this on a daily basis all day like you and I do. So whatever those points of friction or impediments to access, just make it simple and say, here are your maybe 2 or 3 options. Here's your incentive if you choose them. Here's quality scores as a result. Pick. Pick or call this number and they'll guide you to the right spot. And all you have to do is listen to the person that's guiding you. Right?
Yeah, that's the next iteration. And I think when I look back over the course of the last probably 15 years, we've talked about consumerism in this space for a long time. How do we make people better consumers of the healthcare system? How do you make people better consumers when there was really no price transparency? There was no education on what these services were, where to go get them, how to access it, what is best, what makes sense. It's a very complicated system. And we were talking earlier, like if I had to buy a vehicle today, but I couldn't go buy the whole vehicle, I had to go part it together.
Right.
I had to go like buy an engine, buy a body, buy a frame, buy the axle, buy the chassis. And I had 30 different vendors to pick from that were all selling those different parts, and I had to put it all together. I would get tired head, my body would shut down, and I would just quit and say, I guess I'm going to Uber.
Yeah.
I guess I'll take a taxi. And it's almost the same thing in the healthcare space over the last kind of 15 years. These employees that are getting health insurance through their employer have been overwhelmed with complexity, and we've done a terrible job of actually making this simple and using data, using the right tools and resources to make it easier for them to actually be consumers of healthcare.
Well, the analogy you use is spot on, but I think about in a video game, that'd be really fun to pick the engine and pick the chassis and the tires. In the real world, that's untenable, right? Because then you also have to assemble it and make sure it's safe and drive it, right? So like, what are we talking about here? We're ultimately talking about how does the human being that's impacted by all these decisions get to the right place that's the lowest cost, perhaps, but also the highest quality. And I think sometimes people presume if I spend more, it equates to better quality. And the reality is most of the data I've seen, it's actually the opposite. Or I think I heard somebody cite the other day, it's really the middle level of costs usually are the highest quality because they've gotten to a sweet spot that's like a profitable price point, but it's a repeatable price point. And if you hear, if you believe Dr. Trey Smith, who does like Bundled Surgery Center of Oklahoma, he would argue his quality score is proven by the repeatability of the same price over a decade for like a knee surgery as an example, because there's not a ton of variability in that. And so why do the middle kind of cost levels end up being the highest quality? I think it's because they found the sweet spots of profitable pricing and they can repeat it over and over and over again.
ClaimDoc is a medical claim auditing and member advocacy company. We provide fiduciary services to employer-sponsored benefit plans, and allowing them to create an environment where we ensure that the benefit plans are being charged on a fair and reasonable basis.
My business is basically people, and it become a real simple transition. We thought it was going to be far more complex. I've saved, we'll say, hundreds of thousands of dollars. I could not say enough about ClaimDoc.
Yeah, and I think the next iteration of that, to that point, is how do we simplify that decision-making process for the employee and their dependents? And it's not go onto this website, let's go shop all of these different doctors, figure out what services they provide, what their reimbursement rate is. Like, we've already gone too far if that's what we're asking. And then at the same time, if you think the average individual is taking a medication for a condition that they have, now they're downloading multiple apps to try to figure out how to use their pharmacy program.
Right.
You know, maybe they're managing multiple chronic conditions and there's an app to help them do that. Sourcing all of this stuff, making the right decision, figuring out where to go is something that we've got to do on our end to make easier for them. And fortunately, we're in a spot where data science is giving us accurate information that we can distill down into meaningful solutions for an employee to just go straight to that data, and it's going to tell them where to go.
Yeah. Yeah. And I mean, I think that is the future that we're on the cusp of. And just in case anybody doesn't understand that might be listening to this, can you describe what maybe a tier 1 and tier 2 and then out of network structure actually looks like? So there are carriers that do this like automatically, and then there are consultants that will assemble with a kind of a direct contracting entity to achieve that tier 1 network. But can you describe how that actually setup actually works? And
yeah, so one of the challenges that we've had for a while with the larger carriers, and I won't get into the names of who they are, but one of the challenges that we have is when you're a provider and you come into their network, they have to be very careful in how they steer members to those higher performing providers.
Okay.
There's actually contractual language that stands in the way of a Blue or United or an Aetna or a Cigna being able to steer to higher quality, lower cost providers in their network.
Okay.
So that's a fundamental impediment to the member who's trying to access care in the right way. What we're doing now through the data science that we have, through the transparency information that's out there, is we're able to distill down providers in each of these network, both facilities and individual providers and outpatient facilities as well, kind of a scoring system where we're blending actual cost data, actual reimbursement data that's available in all of these machine readable files, and combine that with quality metrics at the same time, overlay that. So then we can create a score. If it's, call it on a 1 to 10 scale, your 8 out of 9, 9 out of 9, 10 out of 10 providers, both at the facility level and at the doctor level, they're producing higher quality results, lower cost of care. We can steer and direct and build a network just around those providers.
Okay.
All within the given networks that exist out there today. And so the benefit structure, what would that look like?
Yeah.
Well, tier 1 would be all of those providers that maybe score 8, 9, or 10 out of 10 would be tier 1. And then you can create a benefit differential there to maybe you reduce the out-of-pocket to the member. If they're going to use one of those providers, remove the deductible cost barrier.
Like wave it all together is probably the best way?
I'm a big fan of waving it all together, and the data supports that based on larger information that exists from some of the carriers that have similar programs out there. You're seeing utilization spike, in the first 8, 9, 10 months of the plan, and then overall claim costs come down, 12 to 18 months into the plan. So the data is supporting that. So I'm a bigger fan of just removing the cost barrier to the member. If they're going to make the right decision, and by right decision, we're giving them all of the information behind it so they can just say, okay, I'm going to go to this provider.
And to be clear, I think it's best suited when it's optional, not mandated. And so I think the tier 2 structure, correct me if I'm wrong, would be revert back to normal copays and deductibles in your traditional network, right? So at the very worst case scenario, if you're still choosing an in-network provider, you're still having to have your normal cost share that you would have had previously. And that's the worst case scenario. But if you make that delta enough, which I don't think that delta needs to be that big, if the average person doesn't have $500 to maybe $1,000 for emergency expenses, if you can make that delta from a $3,000, $3,500 deductible down to zero out of pocket, I'm going to choose that path 99 times out of 100. I would assume most people would, as long as it's simple enough to understand.
Yeah, I think there's behavioral things, traits that have prevented a lot of members, employees from accessing the healthcare system. But a bigger chunk of that is just the cost barrier.
Yeah.
So if we can remove the cost barrier, folks are going to engage more because it's not standing in the way of going to get the care that they need or even preventive care.
Wait, so where does I think because it dovetails into this conversation, where does reference-based pricing fall in this mix here, if any? Because I realize the question can sometimes be based on a very specific geo-metro or a state level. Mm-hmm. But do you think there's a role to play with this type of structure with a fallback of more of a reference-based pricing setup than a traditional network?
Yeah, I think that there's still the allure of reference-based pricing. One of the challenges that we have with reference-based pricing, and I'm a believer in the model. It's not for every client.
Agree.
But I'm a believer in just the theory behind it and what we're trying to address in lowering the cost of care. The challenge that we have is most of healthcare in this country is dominated by the BUCAs and the way they structure their networks. And so one of the things that they haven't been so forthcoming with, because they negotiate based on discount or bundled payment or episode of care, DRG type reimbursement models, the reference-based pricing has not been transparent to the market. So where Blue, Aetna, Cigna, and United sit in paying claims as a percentage of Medicare is not information that is readily available. So it takes a very forward-thinking, very aggressive client to move into a reference-based pricing model. And you got to have the right consultant that can, without that transparency, can walk through what does reference-based pricing actually look like and what is our best guess of where the network is. And now we're getting to the point, we haven't had this until just recently, where we can take that data that we talked about that exists out there on all of those different networks and all of the machine readable files that show reimbursement by network. And now we'll be able to compare that to reference-based pricing from some of these models exist. Before, there was really no benchmark. There was no comparison. You were guessing as a consultant as to what you thought the cost savings might be in a reference-based pricing.
And even, getting to, I know we'll never get down to the absolute accurate level of what the average reimbursement rate is by carrier, by region or right location. But I think there was a RAND study that came out last year that said on average across the country, plans were paying somewhere around 252% of Medicare. And I think in states like California, that was closer to about 300%. So regardless of what tool actually gets us to what the real price is, I think we all sort of accept that the traditional network that's based on discounts is getting us to 2 to 3 times Medicare, which is an unsustainable price point to get to. The real goal is, how do you drive to the true price? You keep it at a level that the hospital system or the physician practice can make enough money to keep the lights on and to stay staffed and do a good job. But we haven't found exactly where most of those price points are today to be able to speak to what is true and fair reimbursement. I think we're getting there. It sounds like some of the tools you guys have access to are going to help us get there.
So I think from a transparency perspective, the carriers rolled out transparency information like going back to 15 years ago. How that was actually leveraged or what the accuracy of that was or how a client could deploy those strategies never really seemed to work itself out. But I think we're getting to a place where the data is more readily available and it's accurate. We know exactly what a claim is going to cost by provider, by facility, by zip code, going all the way back to the provider ID number or the tax ID number associated with that claim and that date of service. And so the data is becoming more accurate. And so the carriers have never had to really compete on actual cost. They've had to compete based on theory of cost of care and directional information. Now we're getting actual reimbursement information for the exact claim at that provider, at that facility, that's going to allow us to make better decisions and help our clients and employees make better decisions. And I think through that competition, the facilities that exist out there are going to have to become more efficient in how they run their business. And I think the Blues and the Aetnas and Cignas and Uniteds of the world are going to have to go compete in a different way versus just looking at, some theoretical directional cost of care analysis that they provide.
Well, guess what? So if we remove all of that opacity, the confusion about billed charges versus allowed amounts versus ultimately getting to a revised paid amount at some point months down the road, where you have a very large portion of a hospital staff that's job is billing and reconciliation and chasing down collections for members. What if we got rid of all that? If the carriers then had to compete on true price, you have hospitals now that might be able to eliminate perhaps some of the staff that's solely dedicated to what I just described. If they become unnecessary because I know what the price is already, employer knows the price, provider knows the price is disclosed, insurance carrier knows what the payment should be, boom, done. You're paid, and you're paid quickly. And perhaps we eliminate some of the administrative bloat, that, if you will, that both the hospital systems and the insurance companies have for that billing process alone.
Yeah, how
great would it be if I just logged on and used a payment card and my employer paid for my knee surgery and the private provider got paid in 24 hours at an agreed upon price that everybody was happy with, and we moved on? How much more efficient could we do that if we could do that hundreds of thousands of times a year across the country?
Yeah, I think we're seeing it now. I mean, look at what Dr. Smith has built and done in Oklahoma. And so it makes sense. And those models are popping up all over the country. So it exists today. I think for it to really take hold nationally and on a grand scale, the bigger carriers and the bigger healthcare systems, the health systems, the hospitals, are going to have to be able to compete. It's going to force them to be more efficient.
Yeah.
And I think what we can do on our end of this is make sure that we're educating clients on what tools, what strategies exist out there, and kind of, Noah's Ark 2 by 2, start stacking these things together and creating competition. What I've already seen just in the last 18 months in this business, because of these zero out-of-pocket programs that exist out there now, you have employers that are actually marketing to their recruiting efforts and bringing in employees and using their benefit plan design and the insurance company they're with or their health insurance program that they're in to recruit employees.
100%.
And that hasn't happened in a really long time, except in the oil and gas business.
We cite an Allstate study, and I don't know, I haven't seen the actual study itself, but I've seen the data points from it, that somewhere around 78% of employees would leave your business tomorrow if they got better benefits elsewhere. So 4 out of 5 effectively said, yes, I would consider leaving, or I would leave if another employer was offering me a better benefit. So there's no doubt in my mind that something like a $0 copay structure of a plan is an absolutely phenomenal recruiting tool. Because after salary, this is the next thing that people are thinking about when they decide on a job. Having spent years working alongside healthcare leaders, brokers, and employers, I know how overwhelming healthcare can feel for our customers. We've all been there. Those renewal conversations that never seem to get easier. Rising pharmacy costs and medical costs, and no real transparency into where healthcare dollars are going. That's why I'm excited about Nomi Health. They're not just fixing the old system. They've rebuilt self-funded benefits from the ground up. With Nomi's network, you can offer something truly different. No copays, no deductibles, zero out-of-pocket costs when members see a provider. It's the kind of benefit that makes everyone ask, why hasn't healthcare always worked this way? Ready to bring your clients something different? Visit nomihealth.com and see how Nomi is rebuilding healthcare, one employer and one community at a time.
Well, and then think about whether it's reference-based pricing or whether it's larger deductibles and larger coinsurance and balanced billing that exists. So if you think about just the customer service and claims issues that pop up in our business due to the lack of understanding that members have as to how this plan actually works and what am I paying the doctor and what is my insurance covering and what is my bill on the back end of this, they're turning around and going to HR HR is coming to us saying, how does this work? We have a customer service issue or a claims issue, and are they paying the right amount? All of that tends to go away in this model. And so you're creating efficiency, you're creating better understanding, and the employee feels like they're getting something of value probably for the first time in maybe 20 years in this business.
Yep, I would agree with you. Well, so why don't we move and shift gears real quick, because another subject that you and I were discussing is really would be compelling for this conversation is an idea around HR responsibility, but HR tech, which I'll go ahead and tell you right now is a foreign language to me. So you're going to have to educate me on the role of HR tech and maybe the value that it brings to HR folks, and why you think that's a crucial thing to discuss for today.
Yeah, I think one of the things that we operate in as we consult with clients is we spend a lot of time with the VP of HR, the CHRO, the benefits manager, and also the CFO as well. Mm-hmm. But what I find is folks that are in HR did not get into HR to become insurance experts. They got into HR because they like working with people and they like helping people. Mm-hmm. And what we're finding in this complicated system that we're working in now is that, we talked about compliance, we talked about doctors being involved, we talked about paperwork and all of these friction points that occur. For a benefit program to work really, really well for an HR person, it has to be able to integrate with the software that they're using to run their people business. Okay. Whether that's payroll, whether that's onboarding, offboarding, compliance, taxes, all of that is baked into the HR technology that's running their business. And what I've found is that we talk less about health insurance and employee benefits these days and more about the integration of all of those different products and services coming together. So if you think about the HR professional today, most people would think that the HR professional is spending 50% of their time worried about benefits, the health insurance plan, the life, the disability, the vision, the dental insurance program. Not even remotely close to what they're actually dealing with on a daily basis. Okay. The system that is running their business and their entire HR operation, they're spending 3 and 4 and 5 hours a day in that system. So if you think about it, they're paying their people out of the payroll system. Okay. They're recruiting and onboarding, new employees out of that system. Taxes and compliance, HR compliance, all comes out of that system. And so they're in it 3 and 4 and 5 hours a day. Mm. And if it doesn't talk well to all of the different insurance companies that they're utilizing to operate their benefits program, you've got problems that fall on the HR person's desk. Keep in mind, they want to get back to the people side of the business. Yeah. So if that technology is not working and it's not integrated well, it's costing them time, it's costing them money from getting back to making sure that they build the right culture and they have the right people culture within their organization. So one of those friction points that exists is something that we're trying to solve for. Okay. And so we wear all of these different hats now, but one of the main hats I feel like we wear is having a good understanding of HR consulting and the integration of that technology that they're using to run their business and making sure that it aligns with their employee benefit program.
Yeah, and I'm just hearing you talk about this. And again, I'm pretty naive in this space. Nothing I've ever sold, or I haven't personally had to interact with an HRS system because of, not being on the HR side, other than maybe logging into an ADP or a payroll software to check, download my tax statements or something. I kind of have a better insight of, hey, if you put together a relatively complex benefit package, does it fit nicely within that framework, or does it all make sense? Can they manage it well within there? Or now do they have other parts that have been bolted on that have to be separately managed outside of that system? That could create a headache for an HR person then.
Yeah, absolutely. So you can have the most perfectly designed employee benefit program that meets the needs of that employer and their employees from a culture perspective. But if the technology doesn't talk to their HRIS system or the HR technology that they're using, and you've got billing errors and fat finger issues that occur, or hardcore integration issues that are happening where data is not feeding appropriately, it becomes a nightmare. And so this well-designed employee benefit program that you've put together doesn't get to shine because it's being undone by integration that doesn't talk.
It might even have a sort of a negative connotation to it because it didn't fit nicely within that framework. And so the perception may be, oh, this thing's clunky or it doesn't work. But the reality is you're probably trying to put a square peg into a round hole in some of those technologies. And therefore the experience is less than what it was supposed to be because of that reason, right? So like, how do you fix that? How do you resolve that? How do you pull in a complex unbundled health plan with multiple point solutions and make it work seamlessly within HR tech then?
Yeah, it's interesting. If you would ask me probably 10 or 15 years ago, HR folks, like the bane of their existence would be changing payroll companies.
Okay.
Or changing HCM. Now, because they're in the system as often as they are, and it's so meaningful to how they operate the business, when it breaks, they're willing to move like that.
Yeah.
And I would have never thought that. Even a couple of years ago, I would have never thought that. I would have thought it had been easier to undo and become the new broker with that business than it would be, to get them to change their payroll system. Now they'll change their payroll system at the drop of a hat, and they'll wait forever to change their broker.
To your point, we were going through a renewal and negotiating with a consultant the renewal price point, and I won't get into that. But the emphasis that consultant put to us was like, hey, they scrutinize every dollar they spend. I'm like, okay. And she's like, well, for example, they've changed their payroll system 3 times within the last 24 months to save money. And it's like, okay, so they're literally scrutinizing every dollar. But that speaks to what you're describing, which is the willingness to flip a system overnight, and the possibility of even doing that in today's world with technology, doing it 3 times in a 24-month period would have been unheard of maybe 5, 6, 8 years ago, right?
Yeah, it's the vehicle that's driving their business. So they're in that system all the day. We're in our vehicles all the time now. And so when our vehicles don't work, we're willing to go get them fixed or swapped out immediately. And it's no different for an HR professional. If that system is not working, they're not afraid to make a change. I think one of the things that's also interesting in this process is if the benefit program is designed really well on the front end to make sure that it integrates and you have a full understanding of all of the technology that they're utilizing, how they're utilizing it, what's meaningful to them about that system, then we can do really good work in making sure that the benefits program speaks well to the technology that they're using to run the business. The other thing that I find too is that from a carrier perspective, so the insurance companies that we work with, now they're offering incentives, or I'll call it additional dollars that exist when technology integrates well. So if there's a system that they like talking to and it works well with that payroll system, there's operational efficiency that the insurance companies are gaining when the technology works well and is integrated well from an HRIS perspective.
No, that's interesting. So you get an incentive to use the tool that carrier wants you to use. Okay.
Well,
if it integrates well, I mean, it makes sense on paper, right? But that's a carrier ultimately, perhaps dictating the outcome to a degree by those incentives, which is fine. I mean, if it works for the employer. But question for you, and maybe this is more of a philosophical question. Do you feel that the HR person should have a lot of the responsibility of benefits procurement? Or should it be by committee? Or what should that be something eventually we'd seek to take off the plate of the HR person necessarily if they didn't get into that business to be in the world of insurance, yet they are? Do you think that's appropriate to have them be one of the gatekeepers for the insurance selection?
Yeah, so similar to our business, on the broker consultant side of the business, we wear multiple hats now. We have to be well-versed in all of these different things that are affecting the business and the HR team. Well, they've had to do the same thing. So there's more compliance, there's more regulation, there's legislative efforts that have been made that put more on the HR person's plate. Mm-hmm. And so, yes, they almost are forced to wear a lot of those hats, and we try to come alongside them to take some of that burden off. But it has to be a collective effort, because the folks within an organization, whether it be the CEO, the CFO, the VP of HR, CHRO, the benefits manager, the benefits director, they all have their own lens in how they make that decision. Mm-hmm. And so I feel like it's incumbent upon everybody to come to the table for the right decisions to get made, because the right decisions for each one of those individuals are going to be different.
That's back to what you were describing at the onset of this discussion with Dr. Bricker's different personas and the way that those personas ultimately decide on something like a benefits package. I just view oftentimes, especially with the HR person who's being burdened with going out and helping source some solutions that might be more complex than the business has done before, and feeling some consternation about, oh, what does this mean for me? And can I handle it? If I'm just me, I'm a staff of one, do I understand how monthly payments on claims dollars work when I've just been paying premium before, right? And so I try to empathize with that person in that setting, but also I can see through a financial lens that at some point these businesses are going to have to make different decisions about benefits, or they're going to keep getting in a worse position as a result of that. And so you appreciate the influence the HR person has, but that's not the only person you can speak to in a process like we have of trying to get to them to be self-funded and a captive. And so how to navigate each one of those stakeholders becomes like the billion-dollar question ultimately for a salesperson like me. So I'm just constantly trying to think about how to be best at that particular aspect of my job.
Yeah, no, I mean, that makes total sense. And if you think about, was it Steve Jobs who said, if I take care of the employees are going to take care of my client?
Yeah. Yep.
And so it's the same way. So if you depending on the definition of the client, so for an HR professional, their client is the employees that they're taking care of, and our job as consultants is to come alongside them to make sure we're doing our part to help them take care of their employees so that those employees will take care of the business. And that means something different for an HR professional versus maybe a CFO or a CEO. And so getting back to the original question, I think it makes sense for all of those parties to come together and that we make decisions that best benefit the employee so that they can take care of that customer base, which ultimately will take care of the business.
That's a great way to segue out of that. And why don't we do this? We'll zoom out to finish up the show. There's usually two questions I typically like to ask of my guests, and this is you just having open forum to get to weigh in on whatever you think. But healthcare at large, we kind of just talked about the networking structure and the access to data. That's somewhat of perhaps an answer to this question. But if you were to look into Trey Smith's crystal ball for healthcare in the United States in the next couple of years, what big changes are you anticipating coming, whether that's legislatively or whether that's just pure business?
Trying to anticipate what's going to happen from a regulatory environment is really difficult. What I see happening, though, is data really allowing us, and AI allowing us to make better decisions in how we build the right plan, how we access the healthcare system, and how we make it meaningful for the employees that are actually utilizing the healthcare system. So data is going to be huge. You probably hear that all the time. But I think AI is also going to change a lot of this, just in terms of some of the mundane tasks that create friction in the system. A lot of that is going to be removed. So if you think about 10, 15 years ago, in our business, it was you got business, and every single brokerage firm out there, and even the insurance companies that were working with the brokers and clients, would all talk about service. Well, our service is better than everybody else. What does that even mean? So in the old model, that was your ability to solve claim issues, your ability to get somebody a new ID card when they lost their ID card, or, to get them care they need, if it was an HMO environment and they needed to go see a specialist or something. Those are the things that we hung our hat on. AI is going to remove all of that from us. And so I think if I were to have a crystal ball, what we're trying to do at Hub, and where I'm trying to lead our team as well, is how do we leverage the data and technology in a very meaningful way so that employees, business owners, C-suite, HR folks can make better, more accurate decisions and reduce the friction point and the noise. And I think AI and data is going to come along.
Well, to your point about AI, I was actually thinking about this the other day. I noticed I'm less often going to Google to ask a question versus using X or Twitter's Grok as their version of it. If it's a simple question where I just want a direct answer, I just use my X app and go into Grok and type the same question I would have normally gone into Google. So I'm already seeing the transition in my own life away from, just Google it, to now being dependent or trusting the AI. And I don't fully trust every single answer because it hallucinates. But if it's something straightforward, like the other day, I'm like, build me a 4-day body part split for a 42-year-old man trying to do XYZ, spits it all out, and I'm done, right? I'm not Googling anymore. So why do I bring that up? I think my kids may never Google anything. they're literally just going to get their answers probably directly from some AI interface. Why wouldn't the same thing happen at scale within the benefits world or HR tech? I mean, I was telling you, my buddy Jonathan, who works for Avant Health, which is a TPA, well, they're deploying AI agents for scheduling purposes, where the AI agent is literally saying, this person needs this procedure, here's the best option, go call and literally use an AI agent to schedule that and get that person into the office in what's most efficient for their schedule. Boom, done, right? So how do you make it easier and easier? I think AI is going to play a phenomenal role in doing that.
Yeah, two things that I would say. I don't know if you've Googled lately. If you Google, it's AI that shows up
Yes,
first.
it is. It's literally spits out the top answer is AI.
Yeah, and the same thing with like Microsoft Bing.
Yeah.
It's running AI and not giving you a formal, search like we used to have.
Right.
The other thing that's fascinating too is, so I think it was 3 weeks ago, a month ago, IBM laid off 8,000 employees, and most of those were in HR, and most of them were HR generalists, and they're all being replaced by AI bots. And so those simple questions that employees had, and were probably going to HR, I'm going out on maternity leave. What is my disability benefit when I go out on maternity leave? Or I'm taking care of, a sick parent. What does FMLA look like for me? Or I need a new ID card. I lost my ID card from our health insurance company. All of those are essentially being replaced inside the walls of IBM and their HR.
Well, like
team.
every new transformative technology, I just hope we figure out the human cost of it, right? Because like in that, 8,000 people losing their job overnight, nobody wants that, right? So the hope is that as much as AI sort of disrupts certain jobs, the creation hopefully will offset, or maybe even more than offset, perhaps the loss of some of those jobs. And I do think we'll probably go through a period where there's going to be some displacement of employment, unfortunately, as a result. And my hope is that we just take care and make sure that those people can find jobs on the other side.
Yeah, I talk to our teams all the time. So AI is not going to replace hardcore critical thinking.
100%, it's not.
It's not going to replace emotional intelligence. It's not going to replace that feeling you get when you're in community and interacting with somebody else. And it's not going to become the technical expert, especially in the industry that we're in. It may give you some feedback or some ideas that you can share, but that technical skill that comes from being a student of the game, being able to critically think, being emotionally intelligent, and being able to be in community and interact with people on a human level, AI won't replace any of that. And so if no matter what my role is in our organization or any organization, I would focus on those things.
I would agree with you.
And make sure that we're building out a skill set around that AI can't
Well,
touch.
and one counterpoint, though, is I actually talked to somebody that's using AI for customer service interactions, and they actually found that AI in some use cases could display more empathy to the person seeking service. Because if you think about it, if you go to a doctor or whatever, the doctor's got 15 minutes with you. They've got stress from their own day. They might be hungry. They might be thinking, oh gosh, I got to go do this tonight. And they're lost somewhere else in their mind. And they're trying to solve a problem for you. Well, AI doesn't have the same sort of noise necessarily with all those other confounding factors. And so they actually discovered that the empathy, when a person didn't know they were interacting, almost like a Turing test, where they're interacting with a human or AI, if it was good enough, it was displaying enough empathy where the human being preferred the AI until they were told that it was AI, and then their stance changed after that.
That's crazy.
That's really interesting phenomenon. But okay, so got to wrap up the show. The last question I usually ask Trey is just your closing thoughts, man. We covered a lot of really cool ground, and so I'm so glad we did this episode. But for the folks that have stuck around all the way to the end, and I hope it's most of them, what would you want to leave with those folks?
Well, I would just say I feel like our business is in a really good place. It's in a much better place than I would have said it was in, 10, 15 years ago. I think there's new technology that's coming to the forefront. There's new solutions that exist. We're being forced to innovate in our business. We may not be able to fix this crazy, complex health system that exists in this country, but the information that's being shared now will allow us to make better decisions that ultimately I think will lead to better outcomes moving forward.
I would agree. And I think almost we might be on the verge, if you will, of a better system coming in the wake of this one, perhaps. I don't want to say imploding, but losing its utility and its allure I think we're there, and the market is begging for something to replace it, right? And that's not talking about replacing hospitals, replacing doctors, but the way the average person seeks care within that system and then how we pay for it. I think we're getting close to perhaps that being displaced with something newer and better. That's what I'm interested in.
I agree.
Yeah.
And that's my hope too.
That's my hope too, man. Well, thanks again, Trey. I hope you enjoy driving your Ram 2500 back to the airport and get back to San Antonio. But really glad we did this, man. And I can't thank you enough for coming up.
Thank you for having me. It's been
My
awesome.
pleasure, man.